Hi, I'm Dr. Stephen Olmos, and I want to introduce you to how to adjust appliances. So in this video, we're going to go through the process of the tools you'll need, the steps, the different materials, and when the appliances are too tight, too loose, and go through absolutely all steps in preparation for the patient and actually the delivery of them on the patient. So this is a very comprehensive video, and I'm so pleased to have our Chief of Operations and Director of our laboratory, Matt Rago, is going to go through these steps with you to initiate the process, and then I'll do the clinical portion.
So upon receiving your case from the lab, what you expect to receive in the box or the bag is bubble wrapped, as you'll see, which will prevent the models from crashing into each other, causing cuss tips and things of that nature to break. You'll notice that we don't have any teeth-on-teeth contact, nor do we have the bite registration put in between, again, because the bite registration at times can be a little too rigid. And then on the shipment back to your office or to the lab, we end up breaking some of the models, which I'll explain to you shortly, the importance of having these prior to delivering the actual appliance to the patient. And so what we have here is an articulator, which I'll briefly show you our techniques and the reason as to why this is so important and as to why we use it. And so you'll notice on this model we have marked off the Hamler notches and the incisal papilla. What this does is essentially allows us to mount the case using the skeletal structure. And so ideally we look at every case as if they have no teeth, because through ortho, through trauma, different types of movements can occur, and really it just becomes confusing. And so by using the skeletal structure allows us a standard base that we can pretty much rely on not changing unless the patient has some sort of trauma or injury. And so what you'll see is there's a back bar here that's placed along the Hamler notches. What that does, and you can't really see for this example, this patient, she has a pretty good level of cant. But if there is a patient that does have a cant to their mouth or to their anatomy, what it'll do is replicate that. And so in making the appliance, if, for example, the patient was canted a little bit to one side over the other, then that would replicate on the device, where you would have more acrylic on one side than you would the other. And the idea is that upon delivery, we expect you not to have to do any type of occlusal adjustments or anything of that nature. Depending on the vertical changes, requirements for material, there are times where we do have to deviate from the bite registration sent, and that's why we really reiterate having these 3 points captured in the scan or your impression, which really will relay back to easier delivery for you and your staff. So, in addition to the models and the bite registration being sent, you'll also receive in a case here the orthotics that were prescribed, and then a sample of the cleaning solution, depending on the type of orthotic. Here we have the PMT version of the Almost Night Positioner with nasal dilators. You'll notice that all 3 pieces are all put together in one bag, and so don't be alarmed if it looks like you're missing a device or if it looks like they're overlapping. But take everything out of the bag, shake it, make sure that they're all loose, and a lot of times these can overlap to where inside the bag, even sometimes taking it out, it's unnoticeable that it's there. The main reason we do that is just so we don't have to send you multiple containers, multiple packages, and we want to try and keep everything together. Sometimes we pulled multiple patients together in one shipment, and so this allows us to seclude one from the other. So upon receiving the case, the very first thing that we recommend you do, so the first thing you want to do is you want to check the appliance to the working model that you received back. First, you want to check and make sure that there's no anterior or posterior rocking on either side of the device. As you can see, it's solid all the way through, and then that there's also not any lateral rock to it. Another way that you can check is we like to send back a stone example or stone set of the models. The main reason is, and without a doubt, scanning is where the future in dentistry is going. The accuracy is undeniable. But with that being said, the resin material itself reacts differently or responds differently to the PMT material, to acrylic, to any material really. And the difference is that on the printed models, it'll slide or slick off a lot easier than it will a stone model. So what we have found is that the stone model replicates inside the patient's mouth, whereas although everything came from this scanned device, checking it to see the actual fit is just more accurate done on the stone model as opposed to the printed duplicate. Now, when you are making changes, because we are certain that the printed duplicate is the most accurate of them, or anatomy-wise, undercuts, embrasures, things of that nature, if you are doing any changes or any adjustments, which we're going to go through shortly, we recommend that you test it on this device rather than the stone model, in the event that there was a distortion or some sort of change during the duplication of the printed model. With your device, especially if you scan, you'll always receive either a printed model back or a perfectly stone cast. The reason is because we want you to be able to verify beforehand that the appliance fit at least the casts that were given to the lab prior to putting it in the patient's mouth. A lot of times what will happen is if there is an issue, for example, a rocking issue, normally it has to do with just a single cuss tip somewhere that was shortened or distorted in a way to where on the model everything seems fine, but once we put it into the patient's mouth, that's when issues occur. If that happens, then 100% of the time, if it fits on the model but not in the patient's mouth, then we'll need another cast or another impression in order to remake that appliance, because if we were to do it on the same model, then we would basically end up with the same result. So we've tried on here the Day appliance, good retention. The TrueTame for the lower device, again, you want to make sure that the device doesn't come off or won't be able to come off with the patient's tongue messing around with it. You don't need to have as much retention on the lower TrueTame as you do the daytime appliance, given that the patient's not going to be eating with it on, speaking, wearing it throughout the day, things of that nature. And so because there's not as much trauma occurring to the TrueTame as opposed to the Day appliance, that's the main reason why we relieve a lot of the anterior region here on the cut for the TrueTame. So you'll notice that those are shorter for a reason. If you do receive a case where the PMT or the material printed, whether it's the PMT or printed or all acrylic, if it's wrapping down all the way to the incisal edge of the anteriors, there is a reason that we did that. A lot of times, especially for devices like the DDSO, where we have, so in terms of devices like the DDSO, where on the back portion, the device is constantly trying to pull up from the posterior region, and the upper is trying to pull from the canine region. That's the reason why we have to have a certain amount of coverage for that device in order to have proper retention. We have had some concerns with receiving appliances that cover the full facial of the anterior. So if you receive a device where you have the entire anterior region covered down all the way to the gingival margin, it is designed that way for a reason, and mainly it's to prevent the posterior region from popping up. The only way to do that with patients who have either really short clinical crowns or very few embrasures, undercuts, things of that nature, because we can't engage it so much on the posterior region, what we do is we basically wrap the material down on the anteriors, facial of the anteriors, which prevent the back from popping up. If it is a little tight or the patient feels sensitivity, I recommend that instead of going inside of the device and trimming, rather than going there and creating a big mess that I'm sure no one likes to clean up, Instead of doing that, actually take the material itself on the gingival margin up. By doing so, what you'll do is will eventually engage the undercut or relieve the undercut that's causing the sensitivity or the rigidity that the patient's feeling. And so we've had more success with bringing the material up because of the flex of it. We can allow the interproximal material to be there and basically flex out of those embrasures rather than going inside completely taking them off, because once we do take those away, those are hard areas to recreate, especially working with material that's only 1.2 millimeters thick. We really only have 1.2 millimeters of movement for the material. So back to trying on the models. So we have the Trutane, which is a good fit. We have the Day Appliance, which is a good fit in comparison to the models anyways. The Night Appliance, again, one way that we do or we check in lab to make sure that the appliance has enough retention is you want to basically put it on the model and then give it a shake. And I remember this material is a lot more slick than the stone material, and so I'll kind of show you the difference that it does create. And so if I shake him, he kind of flies right off or slips off. Whereas when you put it on the model, there is still a click, so there's some sort of engagement. On the stone model, when I put it on, if I try and do that, there's no way that it's coming off. So on the stone model, you'll find a lot more friction and resistance as opposed to the resin 3D printed model and trying the fit with the device. In addition to checking the fit on the appliances, if you have an articulator that is able to mount using the HIP system, the 3-point contact, then it's nice to be able to put the models onto the articulator, put the bite registration in between, and make sure that everything was mounted correctly. I can assure you that we do confirm that the mounting is accurate 3 times before the case is sent out. And so if you do see a discrepancy, don't be alarmed at first. There's a lot of these devices out there. They all have different calibrations. And so we have tools where you can zero yours into our 0 point to make sure that they do accurately line up together. If you don't have an HIP articulator, then you can still do the same thing or have the same effect by putting the bite registration onto the models and just measuring CEJ to CEJ. Usually we pick one of the central anteriors of the upper and the lower, measure that distance, and then you can match that to the distance of normally the daytime appliance. The reason I say that is because if you send in 1 bite, then normally it's a minimum speaking space bite or a daytime bite, and what we'll do is we'll increase the vertical for the nighttime appliance. If you do have any alterations to the vertical or protrusion, retrusion, all of those things come into effect to the 3D occlusion of the patient. So just keep that in mind or take that into consideration when you're measuring those distances. Over here we have 3 trimming burrs, which ideally they all have a separate function. They can be used for acrylic. We recommend that they're used for the nylon especially. The main reason is because they're heatless burrs, and so as you're trimming up the material, it grades it away more like cheese as opposed to chipping it away and having a bunch of flakes end up all over and creating a mess. There is a learning curve in a sense when it comes to using these, because you are going to get to where it never leaves a completely clean cut on every appliance. And so I can briefly show you in a little bit on how to go about adjusting these things and using different types of brushes to get it to where if you do have to make alterations or changes to it, that you can finish or still deliver the appliance with this smooth finish. We do recommend that if you are going to go and make changes to the device using a burr, to try and bring the material, the gingival margin of the material down, or if it's on the lower portion, bring the material up, as opposed to going inside and creating a mess. One, it's less time consuming, and two, it prevents you or your staff from having to go in and try and clean up all the what I call frillies that are created in the adjustment phase. Again, if you're adjusting a lot of appliances, that's not normal. That's not what we expect, and so please give me a call if that becomes a constant or a consistent issue, and surely we'll get to the bottom of the exact reason that's happening. Every doctor, every client has their own preference on what perfect retention is, and I assure you, as soon as we are able to find out exactly what that is for you, that's what you can expect on delivery moving forward.
Okay, Rick.
So here we have 4 models. The 2 on the left here, we have one printed that's very loose, just as I showed before how we check to make sure that there's enough retention on there. Again, with the PMT, also very loose. And then we have over here a PMT version that's not so loose, which you can hear. And then a nylon version, it's not so loose, which again, you can hear the retention as you're taking it on and off that appliance. And so my recommendation anytime when it comes to manipulating these things is to try our hot and cold water technique first. The main reason is because by doing this, we're not taking away, we're not altering the material at all. Really what we're doing is just recreating the retention that either we lost over time, because there are, depending on, the patient's acidity of their mouth, how well they take care of the device, things of that nature, all of those affect, how these last over time. And so if you do have an appliance that's loosened up, or you do have, maybe an appliance where the cast that we worked on, wasn't an exact, but it's not so much to where you need to get a new appliance made or have the patient, wait another turnaround time to get something remade, but something that you can just adjust very easily chair side. And so what we have here is 2 bowls of water. The one here is a hot bowl. And when I say hot, I mean not boiling, but definitely coffee hot. And so you should be able to see steam coming from the bowl of water. And what we do is to relieve a device, for example, let's just say it was the left portion that the patient maybe said was a little tight, or they felt sensitivity, or you could tell it just wasn't seating properly. What I recommend you do is put that portion of the device into the hot water and hold it there for 5 seconds. So 1, 2, 3, 4, 5. After, bring it over to the model, and you're just going to take it on and off, on and off, on and off. And what that's doing is you'll see as I press down over the model, it's basically spreading out over the height of contour. And so wherever it was getting locked in before, now it's able to at least relieve itself from being so engaged into that interproximal space or the undercut, to where you can see already the difference of pulling off this side. I can do very easy, as opposed to this side, which I still have to pull with a lot of force. To show you the outcome of doing an entire device and really how manipulatable this material is, I'll dunk the whole thing for about 5 seconds, and then again we're going to put it on, off, on, off, on, off. At this point, I would say it's okay to try in the patient's mouth, see if that relieved it enough. If it doesn't, then again you can put it into warm water for another 5 seconds or so, on and off the model a couple times, and depending on the severity of how locked in or how tight it is, you should find success in being able to relieve sensitive areas and things of that nature by just using the hot water bowl. The same thing goes for the PMT material. It's not as manipulatable as the nylon, of course, because it's nowhere near as durable, but if you are careful, you can have the same effect. Both of these devices are essentially made with heat. The nylon is a powder that's sintered together using a high laser heat, as opposed to the thermoform, which is basically just a disc of plastic that's heated and then vacuum formed over the model. And so again, we have one that's really tight here. If you put it into the warm water for about 5 seconds, take it out, put it on the model, off the model, on the model, off the model, and that'll basically engage those undercuts. And a lot of times you should be able to get to the final result that you need. If in the event that you can't, that's when I recommend taking this material and bringing it downwards. If that doesn't work, then later in the video, Dr. Olmos will show his techniques on how to adjust interproximal and things of that nature. In terms of a loose device, what we want to do is we have a cold bowl of water here, which is going to be used to solidify the new position that we're going to create. And so you can see on this device, there's not really much retention holding anywhere. And so what I would do is start one side at a time. If you put the whole device in, you can put the whole device in warm water to try and relieve it. You're not going to create any kind of torquing issue or anything like that. But if you do put the whole device in and then squeeze both sides and then try and solidify in water, there's a chance that you're going to cause some sort of tweak or torque that could have alternative effects on the patient's treatment. And so I do recommend putting one side in at a time, wait 5 seconds, bring it out. You're going to give it a little pinch, not down at the gingival region, of course, because we don't want to create sensitivity, or if a patient's not taking care of their teeth as well, inflamed gums, things of that nature can cause issues. And so what you want to try and do is squeeze interproximally and in any undercut or height of contour region. And you'll see you can regain retention by doing so. And I usually hold it in the cold water for about 10 seconds just to make sure that it solidifies and stays in the position that we've tweaked it. So you'll see, especially here on the right side, it's a lot more retention than there was previously. Again, with the nylon material, we're able to give it a little more of a squeeze because of the durability of the appliance. And in addition to it only being 1.2 millimeters thick, be careful just not to squeeze too much or too hard at first. Less is better always when you're learning or getting used to this technique. And I do recommend, and if you do need, we can always send out a couple sample pieces for you to try on sample models prior to adjusting these for your patients. But as you can see already for this device, the nylon is much easier to manipulate than the PMT. And so that was just the left side. I would then go and adjust the right side. And you can tell this has ample retention now.